the next level.
My name is Sattar Memon. I'm a cancer physician and I do consulting work throughout the nation, especially on the solid tumors like breast cancer and other solid tumors like large bowel cancer, prostate cancer, and lung cancer. I started my fellowship at Brown University in 1977 and completed it by 79. And right after that, I went into the practice of cancer medicine in Rhode Island. How do you balance just the clinical aspect versus the emotional aspect? When do you stop considering patient a patient and not a human being? I try to fuse both of them. And I say to myself, what if this lady was my mother? What if this lady was my sister? And the answers come. And many times you cannot overpromise because that's a dishonesty. But you can still convey the facts in a kinder and gentler manner. That listen, I cannot cure your cancer, dear, but I can treat it, and the treatment is successful, you can live longer meaningfully. So it works out fine. All you have to do is synthesize your brain and your heart and try to be as upfront, but not brusque, okay? Trying to be kinder and gentler, and it works out.
Super. What's the thing about the book that stands out the most to you? From your point, and what do you think stands out to your readers after they read?
I think those stories, when you are already reading a story, and especially a woman is reading the story and says, aha, this sounds like my aunt, my mother, my sister, I want to read further. Although the names have been changed, some of the circumstances have been changed, they are real stories that have put in a mosaic of those actual patient accounts with illustrations and the pink factoid boxes. So it makes an easy read. People are able to identify with it. Like, that's my aunt or that's my mother, and they want to read it. And those 5-6 stories carry the whole book up to the end. If I have to sum it up pretty good, I would say in the last 60 years, survival rate of all breast cancer has gone up by 300%. And those breast cancer which were not treatable are becoming treatable with meaningful extension of the survival. And those who are treatable are becoming curable. I think that's fantastic. That is very hopeful. That's very optimistic.